Hello, everyone, and welcome to another episode of Talk with a Doc, a new thought leadership series brought to you by HealthSnap, where we hear from the nation's leading healthcare experts on their perspective of technology's role in patient care post-COVID-19. My name is Samson Magid, and I'm the co-founder and CEO of HealthSnap. Joining me today, we have Dr. Cate Collings, the Director of Lifestyle Medicine for Camino Health. Dr. Collins, thank you so much for your time today. We appreciate you joining us.
Hi, Samson. I'm glad to be here.
So I thought we'd start off with maybe a quick introduction to yourself, the organization that you work for, and a little bit of your background and career path of how you got to where you are today.
Sure. Thank you. So again, I'm Cate Collings. I'm board certified in cardiology and lifestyle medicine. And I practiced I practiced cardiology for the past 30 years. And in the last 2 years, took a new position as director of lifestyle medicine for a system here in the San Francisco Bay Area that is making itself transitioning itself from a hospital to a healthcare system. And we had this opportunity to really build lifestyle medicine at a foundational level within the ambulatory setting and create those connectors to the hospital as well. And in terms of my career path, like you, Samson, I started in exercise physiology. And so I really started my career from a healthcare perspective rather than a sick care perspective. Medical school doesn't necessarily foster that continuation. And certainly clinical care in cardiology is a lot about sick care. I was, through my cardiology career, able to, keep a connection to healthcare through my role as medical director of our cardiac rehab program here at El Camino Health. And so in that way, I kept my foot in that area of medicine. But now I've really, come the full circle around. And my main focus really is that we really have to build a healthcare system, not just a sick care system. We need the sick care, but we really need the healthcare more.
Absolutely, and love it as somebody with an exercise physiology background and nutrition background. That is obviously music to my ears, hearing a practicing physician so passionate about disease, not just management, but also disease prevention as well. So this past year has been, and the widespread use is unprecedented, of course. We've seen a massive increase and surge in virtual care solutions, and it seems to be all the rage and widespread adoption. So I'm curious to see and hear from you how El Camino has adopted virtual care solutions over the last year, and if you could share your thoughts on if you feel virtual care is here to stay post-COVID-19. Would also love to hear throughout the last year if El Camino's strategy has changed as a result of any virtual care solutions that's been implemented over the last year as well.
Sure. Yes. If there's anything COVID has taught us, it's that we have to be agile and change. I think what we saw at our institution is just that every day we had new recommendations coming forward, new ways we needed to interface with patients. This was always depending on whether we were in a surge and what the county was saying. And so constantly changing. And so agility has been a big part of that. And absolutely, virtual care has been accelerated and amplified during COVID, as well as, I would say, the workflow to accomplish it. And so, while these were ideas in the making for, probably a decade, it was only when we were really forced to really develop the workflows and just step into this arena of really providing virtual care that we began to see how well it works. So I think virtual care for patients is here to stay. I can't imagine rolling this back because it's actually making multiple touch points with patients so much more accessible. So I think virtual care is here here to stay. I would say that one of the limitations of virtual care, if you just talk about seeing a patient virtually, is that you don't have some of the vital signs that you've taken in those patients. And you're asking for self-reported values and things like that. So you're not really knowing how the patient is doing from those important vital signs and biometrics, except for what they say as self-reported. And so combining, having within the virtual care the capacity to actually have that data draw into that encounter is really where it's important.
Yeah, that is obviously fascinating, and it seems like everyone had to really quickly adopt. And I love the idea of being agile, similar to a startup, and being able to embrace the change and saying we need to make a solution work today. Um, as a result of the last year, have you guys changed maybe your tone on what's important to El Camino from a solutions perspective? I'm sure you had to make decisions very quickly and be able to engage with your patients routinely, but what have you learned as a result of adopting a virtual care solution or telehealth solution? And how do you feel like that's going to inform your decision making moving forward when it comes to either a solution or something that is going to be required to make this stick widespread with patients and uh, be able to deliver the patient experience that you're probably looking to deliver at scale?
Yeah, so I think what we've learned a lot about is just who do you need to bring in as the team members when you have um, technological platforms that you're trying to integrate. Who are the people that you bring in to incorporate that, to develop the workflow, and to make that solution come to being? So I think there has been a big learning curve in that. Who do you bring to the table to do this when you're working? And then I think the second thing is, having your audience, your patients, your clients have the confidence to engage. And so we certainly saw that we had to increase their confidence. And we were very early in our clinic development, even in the EMR integration and bringing patients into messaging through our EMR. And so we rapidly had to reach out one by one to these patients and get them to sign up and start feeling comfortable with messaging through the EMR app. And so a big campaign happened with that to get that into place. And so it really comes from both the infrastructure for the providers, for the administration, for IT to see what it takes and to be able to rapidly deploy these solutions and understand what goes into it, as well as knowing how to get the patients to be confident to engage with these types of solutions, whether it's just a Zoom meeting or whether it's something more advanced than that.
Got it. And that makes perfect sense. And I think a great segue into next discussion point, something that I know you're very passionate about and proud of in terms of starting a new movement. But you mentioned before, but you're also the president of the American College of Lifestyle Medicine. So I'm really excited to dig into the next topic, which is value-based care. There's a tremendous amount of buzz, or has been a lot of buzz, around value-based care for over a decade, but unfortunately little outcomes as a result of that conversation. We've heard phrases like value over volume and prevention over treatment. And so I'd love to hear what value-based care means to you, to your organization, and also hear your perspective on what challenges exist to widespread adoption of value-based or outcomes-based patient care.
Sure. Yeah, so there's so many different definitions about value-based care, and I have to say that a lot of them have to do with who pays the bill and come in from the financial model strictly. But I kind of go deeper, and I really put value-based care as really self-care. And when we talk about self-care for the patient, we're really talking about them being empowered in their own lifestyle care. and self-care. And I think that's the equation that really gets to the final goal of better outcomes, a better patient experience, and lower cost. And so we can rearrange all of the parts, but if we fail to get that part of the patient actually understanding that they have the locus of control, a good bit of the locus control within themselves, if we don't get that part right, we're just going to be adding resources and we'll never get to that equation where we get better outcomes at a lower cost. We might get better outcomes at a higher cost, but I don't know that we'll get better outcomes at a lower cost. So self-care is really the least expensive piece of the equation in value-based care. And I think it's where we have to leverage.
And as a practicing physician, I'm curious to hear. Obviously, you preach lifestyle and behavioral change every single day to your patients. And when you talk about self-care, what has been the most effective way to promote self-care within your patient populations? And what do you feel like is a challenge for patients? And this is a widespread conversation that I have every single day about patient demographics and access and education. So I'm curious to hear what the most common challenges you're experiencing are when you actually deliver lifestyle medicine and in practice.
Yes, and I think one of the first barriers is just actually very much a very is awareness. People just think that they are victims of whatever has condition has they have genetically, or the condition that's been developed in them, and they tend to not first understand that they have again a piece of this. They may think they had a piece of it from prevention, but they now don't think they have a piece of it in terms of managing, if not allowing some remission of the condition. So that just basic awareness piece is the first. And then a deeper education is the next piece for people to have, a deeper, if you will, aha moment of seeing what is possible. But as it always is, you really have to get, and I know this is really important in digital health, but it's important in person health, is engagement. And engagement comes down to really understanding the individual and what it is that they are seeing for their future, and what is their why, and what is their vision for their health. Um, and when we get those things aligned, then we can put the pieces in for behavior change, and it's a lot smoother. They now know what is possible. They're activated. They know why they want to do it for themselves. And then it's a matter of now just plugging all the pieces in, where there's self-monitoring, and the other tools to actually get to their goals.
Got it. Yeah, no, that makes perfect sense, and um, it's a great breakdown of awareness, education, engagement, and being able to set the foundation of value-based care, not talk about it, but actually how do you talk about the process of getting to the outcome. And I love that breakdown. I think it's a really clear way of really dissecting how to create that engaged patient, and an engaged patient is a healthy patient. And I think that's a couldn't ring more true than ever, especially while we're engaging patients in a very different way today. Um, with that, I'd love to wrap up with your closing thoughts on technology's role in healthcare delivery. Obviously, the last year has, I think, opened up a lot of eyes to what's possible. And so I'd love to hear your perspective on technology's role in healthcare delivery in the future, as you think about post COVID-19, or even still during COVID while we're dealing with ongoing issues as well.
Yes. Yeah. So I think, the role in healthcare delivery, I am very excited about just ongoing technological advancements in the delivery of care. I really am looking forward to getting a tighter cohesion between, again, patient care that is delivered by people in the office setting or in the clinic setting, um, but also leveraging uh, things like chronic care management or remote patient monitoring, so that there are multiple touch points and more fostering of engagement with patients and ongoing engagement. And I think lifestyle medicine, who sits at the hub of technology is really important. And I think when I think in terms of technologies such as remote patient monitoring or chronic care management, the person that is sitting at the hub of that, it needs to be somebody, in my mind, somebody who is lifestyle medicine trained. So whether it's a nurse, whether it's a coach, so that they can ongoing, while they're doing things like possibly needing to change medications, but they are also integrating lifestyle medicine, self-care into all of those encounters. So who is at that hub is really important, and creating that seamless workflow between the care they get in the clinic and the care they get at home, and how they care for themselves at home with this technology is really, really important.
Yeah, absolutely. And putting all the pieces of the puzzle together, it's um, really exciting to see happen in real time. And I really appreciate the perspective on being able to combine that hybrid approach of in-person care and continuing that and engaging patients throughout the entire continuum of their daily lives as well. So appreciate the insights there, Dr. Collings. With that, we'll wrap up today's episode of Talk with the Doc. Dr. Collings, thank you so much for your time again. We really appreciate it, and looking forward to staying in touch soon.
Okay, thanks, Samson.
Thank you so much.